Good evening, and thank you for joining us for the third and final event of this year's RCN Scotland Student and Newly Qualified Nurse Conference. Our annual conference for RCN students and newly qualified members has increased in popularity every year, and this year, given the current COVID-19 restrictions, we have moved to an online format, which has allowed us to reach an even wider audience. The previous webinar sessions led to fascinating discussions around the health and well-being of nursing staff and on the future of nurse education. Recordings of all these events will be posted on our website. I am sure tonight's event will lead to the same level of debate and discussion as the previous two. Before we start, I'd like to take this opportunity to encourage you to share your experience of being a student or newly qualified nurse during a global pandemic. We have a new tool called SenseMaker to help us capture your experiences and use your feedback to shape our work. I cannot tell you how important it is for you to share your lived experience with us so we can represent you, speak for you and fight for the things that matter to you. Please have a look at the SenseMaker tool and share your experience of the last week or even your last shift. This will take you no more than 10 minutes. Your voice matters, so this is a way to use it, and believe me, we will listen. Take a note of this link or find it on our website. This evening, I am delighted to be joined by such an experienced and prestigious panel for our discussions on staying well while working shifts. We will hear from each of our panel members in turn before opening up for a wider discussion. We want you to be involved and to share your views. Please post any questions you have on the Q&A function. And during her presentation, Chiara will ask you to use the link previously shared with you. I will put as many of your questions as possible to our panel. If you would like your questions to be directed to one panel member in particular, please include this with your question. We will also be tweeting during the event and would be delighted if you can join the conversation online. Please tag at RCN Scot and use the hashtag #NursingAndYou. This event is being recorded and we will also post this on our website. I'm now going to ask our first panellist, Kim Sunley, to introduce herself and share her thoughts on staying well while working shifts. Kim, thank you for joining us this evening, and over to you.
Thank you, Eileen, and thank you for inviting me to speak at this event this evening. I'm delighted to be here. So I'm just going to very quickly just check everything's in order, and you can see my slides. Thank you. Okay, so I'm going to talk a little bit about night shift work. I'm going to talk about the risks of shift work, what organisations should be doing to support employees and staff around shift work, and a little bit about what you can do to help yourself. Sorry, just a little bit about me. I'm Kim Sunley. I'm a national officer at the Royal College of Nursing. I have a UK-wide remit, and I lead on health and safety issues affecting our members, of which there are many, as I'm sure you're aware, particularly in the current context of COVID. So I'll start by looking a little bit about shift work and the risks associated with shift work. So shift work is potentially risk work. There's quite a lot of evidence around the impact of shift work on health, particularly long-term conditions like type 2 diabetes, digestive disorders, as well as sleep deprivation, obesity, fatigue. And I know you had an earlier session earlier in the week talking about obesity and other well-being issues. And actually, if you look at statistics, 45% of women who work shifts have a long-standing illness compared to 39% of non-shift workers. And the figures are slightly lower in men, so 40% of men compared to 36% who don't work shifts. So it is fair to say that it does potentially cause health problems, and that's because of disruption to your circadian rhythms and to your metabolism. So in addition to the health issues, there is also the issue of fatigue. And 20% of road accidents are actually caused by fatigue. So shift work causes fatigue, which then can cause road accidents. And some of you might have seen back in 2017 the case of a nurse in Ayr Hospital who crashed a car on the way home from a really long night shift. Fortunately, nobody was seriously injured, but the nurse did have to appear in court and also lost her driving licence, had a conviction, and obviously that was reported to the NMC as well. So fatigue can have very, very serious consequences, and we do also sadly know of nurses who have crashed their car and lost their lives on the way home from a long shift. So it's a really serious matter. So I think, as well as circadian rhythms, as well as your metabolism and your body's circadian rhythms being disrupted, it can also disrupt your social rhythms. So your social activities, your social life can be impacted as well, and that obviously has an impact on mental health as well. So I think it's really important to mention that. Just a little bit about fatigue. So fatigue is an issue that arises from excessive working time or poorly designed shift work. So this is a reference from the Health and Safety Executive on their Human Factors and Fatigue webpage. It's generally considered to be a decline in mental physical performance that results from prolonged exertion, sleep loss, or disruption to your internal clock, to your circadian rhythms. And fatigue results in slower reactions, inability to process information, absent-mindedness, decreased awareness, and all those issues. So you can see how that can cause accidents when driving home. But also, I think most importantly here, you can see how potentially impacts on patient safety as well as the safety of nursing staff. So things like potentially like drug errors, can happen as a result of fatigue. Actually, some of the major incidents around the world, like Chernobyl, nuclear disaster, Exxon Valdez oil refinery, and closer to home, Buncefield oil refinery and Piper Alpha oil refineries, fatigue and shift work were factors that contributed to those really serious incidents. So it is something that we need to take very seriously. And actually the NMC code also talks about human factors such as fatigue and how they can impact on care, and there is a requirement, the NMC, for nurses to be under the code, for nurses to be aware of the human factors that can impact on care. So those are some of the risks, some of the issues, but we all know, it's a reality. Hospitals are 24/7 places of work, even outside hospitals, care homes, other environments, 24/7. And actually, it's estimated that 1 in 8 of the workforce actually work night shifts. So, it's not just healthcare, it's actually other people who drive the buses, people who bake our bread in the morning, all those people obviously working shifts. I probably suspect that might have reduced slightly with the nighttime economy being impacted by COVID, and things like clubs being closed and all-night bars, but there still are a number of key workers that are working night shifts, including nursing staff. So a little bit about what we would want to see from organisations to mitigate the risks of the health risks to staff, and to patients, and to those working in healthcare. So there's a list of a few issues here. One is around reasonable notice of shift patterns, and I think that's really important in terms of the social rhythms of life. We all need to know what we're doing when we're doing it, so we can plan our social life and our social activities, though again that does seem quite limited in the current context, but I think it's really important for mental health. And actually something like 6 weeks notice really is something that the RCN would want organisations to be doing, at least 6 weeks notice of shift patterns. We want organisations to be complying with the working time regulations. Now, I haven't got time to go into a great amount of detail about the working time regulations at the moment, but there is a duty to comply with these, and things like making sure if you work 6 hours or more that you have a 20-minute break. Doesn't seem a lot, but that is absolute minimum. I know our next speaker, Chiara, is probably going to talk more about well-designed shift patterns, so I won't dwell on that, but that's really important and a factor that employers must take into account. Facilities to rest, rehydrate and refuel. So have you got somewhere to have a break that's suitable, quiet, that you can access drinking water, you can make a hot drink, and you can have a meal. Now, I know a lot of organisations don't have restaurants and canteens open at night, but you know, do you have somewhere where you can store food and reheat it if necessary as well? So all those things that we would want to see good employers providing. A lot of evidence around power naps, particularly during the night shift. Optimum time for a power nap is 15 to 20 minutes to actually revive somebody when they're doing a night shift. So a lot of evidence, some of the evidence has come from organisations like NASA, and it is beginning to get some buy-in now by healthcare employers in terms of the benefits of it, but obviously we would want anybody who's doing that to follow their organisational policies and make sure the policy does allow for power naps. But a lot of evidence that 15 to 20 minutes before you go into a deep sleep, that can help revive you through a long night shift. Reasonable adjustments. So there may be some people that have health conditions. Long-term health conditions can be affected by shift work. So, for example, maybe somebody with type 1 diabetes may need to have extra adjustments made so they can have extra breaks to take insulin, adjust their food. So employers would need to take into account any needs of those workers. And again, there may be some people with long-term conditions that do have difficulties adjusting to things like night shift. So again, we want organisations to take account of that. Pregnant workers, again, some evidence around pregnant workers finding shift work slightly more difficult, particularly in the later terms of pregnancy. And again, organisations would need to assess those risks and put measures in place to support those workers. Good occupational health support, health checks for night shift workers is a requirement, and also making sure that the duty of care to make sure that staff can get home safely as well after a hectic night shift. So helping yourself really. So there's a few things here. If you can improve your sleep, I know easier said than done. So the whole science around sleep hygiene, and I can touch a little bit more on that in a minute. Also try and learn how to manage night shifts as well. So there's some things that you can do around that, and I'll go into that in more detail. Take your breaks, and you know, we would expect managers to be role modelling as well and taking their breaks. And again, I know it's challenging in the current situation, but even more important than ever to take your break so that you're not having the impacts of fatigue further down towards the end of the shift. Think about jumping in your car, driving home. Are you safe to drive? You know, do you need to just take some time out, have a coffee, just sit and get yourself together for a few minutes? Can you do a car share? Obviously, again, there may be restrictions around COVID and car sharing at the moment, but think about, are you safe to drive home? Ask for help if you're having difficulties with dealing with shift work. Do ask for help as soon as you can. You know, your GP, student welfare, occupational health, and there may be things that they can support you with, particularly around sleep. And there are some cognitive behaviour therapy programs to help people with sleep now. And then just look out for others, really. Look out for others who are struggling and encourage them to seek help. So very quickly, so I talked about the science of sleep hygiene. So it's around how you create an environment and what you do to actually help improve your sleep. And again, there's a whole list of things here, and some of them will seem very obvious. Some of them are easier said than done, but I think they're really important. So I'll just run through a few. So keep the bedroom as cool as possible. 16 to 18 degrees is optimal. So you know, again, there's evidence around cooler environments being able to sleep better. Dark as possible. Invest in a set of blackout blinds. I swear by Argos's blackout blinds, they're brilliant. Mattresses and pillows, and then not all of us can afford a really expensive Hypnos mattress, but maybe just some really good quality pillows will make a difference, or even a mattress topper. Think about your diet. You know, caffeine, it's not only coffee, but other hot chocolates and teas also contain some caffeine, so try and avoid that before bedtime. and also, dare I say it, alcohol and nicotine. Really, again, that will impact on your sleep patterns, particularly if you're going on to a shift. Don't go to bed hungry. Again, that's another thing that can impact on sleep. And avoid sort of stimulants like your Red Bulls or sedatives, so prescribed drugs if you can. You know, potentially short term it might be something on the advice of a GP. But you know, look at, if you are having difficulties, then look at other alternatives like some of the apps or potentially cognitive behavioural therapy. And then get into a routine, prepare for sleep, don't panic or clock watch, warm bath, shower. One thing I found really important is a to-do list. So having something by the side of your bed, like a diary or a notebook, so you can dump all those things that come into your mind when you go to sleep and could cause anxiety or cause worry. So that's a really, if you just do one thing, that's a really useful thing. And then there's lots of apps around as well, but be careful about your screens at night as well. So try and put it onto night mode. I thought I'd just put this slide in because obviously very relevant for the audience. And I think, again, there's lots of research. It's not so much about the quantity of sleep. You know, some will say some papers you read say 6 to 8 hours, some say 8 to 10 hours, but it's more research is around the quality of that sleep. So is it deep sleep? Are you able to get into a deep pattern of sleep where you're dreaming and a deep REM? So and that's a very good book, Why We Sleep, if anybody's interested in finding out more. So managing night shifts, just really run through this. So if you are going on to night shifts at the first time, it will feel very strange, can be quite challenging. And just a few things to suggest here. So the first night, lie in a bit longer in the morning or have an afternoon nap if you can. Prepare your flatmates or your family. You know, you are going on nights, so ask them to be a little bit more considerate. You know, don't get your Amazon deliveries when you're on night shifts if you can, again, if you can avoid that. During a night shift, and again, I'm sure this has been picked up in earlier sessions, but find out what's right for you. I think a lot of the evidence says small snacks during the shift, so slow release carbs are better than a big bowl of pasta at 3 a.m. in the morning. But that's probably probably if you've eaten a big bowl of pasta at 3 a.m. in the morning, you'll probably have felt the consequences of that. Keep moving. I mean, that seems funny telling a group of nursing students and your qualified nurses to keep moving because you probably don't even have time to sit down. But I think, keeping moving is really important, and keep hydrated. And your rest breaks. Again, consider having a power nap if that's permitted. And then when you're coming off your night shifts, the first day back can be quite difficult. Have a short sleep if you can. And try and set your alarm so that you're waking a little bit earlier, and then you are able to try and restore some of the normal activities and your social rhythms as well as your circadian rhythms. Now, I'm sure you'll all have lots of tips and ideas to share with yourselves as well about how you get through it, how you can improve your sleep and how you can manage your shift work as well. So that's really important to share what works for each other. So just finishing off quickly, lots of resources. The Sleep Council has a very good, you can do like a self-assessment on there if you go onto their website, lots of really useful information. RCN, Rest, Rehydrate, Refuel on our Healthy Workplace website, information about power naps and hydration and refueling. Some work we've done with the NHS Staff Council, which is on shift work. The Health and Safety Executive Guidance on shift work. And then obviously I'm sure some of you will be aware of these apps that are approved by the NHS, the Sleepio, Bziz and the Sleep Station. So again, they're really good to get hold of. I'm not sure if one of them has Harry Styles telling you a bedtime story, but I've heard that Harry Styles has a very soothing voice. So I'm not sure which one of the apps does that, but certainly worth exploring if you haven't already. And then this person, Dr. Mike Farquhar, if you're a tweeter, then he's really good to follow. He's a paediatric sleep expert from Guy's and St Thomas's Hospital, but he does a lot of education to healthcare workers on sleep and shift work, and he tweets a lot about it. So again, it's really useful to follow. And have a look at our time and space app videos on our Healthy Workplace webpage as well, because they're mindfulness-based based videos, sorry. So they can help you unwind and work through the day. So again, that's a nice resource you might want to have a look at, particularly the step 6 around arriving home and how you de-stress after a shift. I'll stop it there because I've probably gone over my time a little bit. Apologies for that, but yeah, sweet dreams. Thank you.
Thank you, Kim. Moving on, I'd like now to ask Dr. Chiara Dall'Ora to introduce herself and provide a short overview on shift patterns in nursing, what works and what doesn't work. Over to you, Chiara.
Thank you. Thank you very much. And thank you very much for giving me this opportunity. I'm delighted to be here to talk to you about some of the work we have been doing around shift patterns in nursing. And I will very briefly introduce myself. I'm a registered nurse, and I have been working in academia, in particular on shift patterns for the past 7 years. And I am at present, I'm a lecturer at the University of Southampton School of Health Sciences. And just to give you a quick disclaimer, I'm funded by the NIHR, which is the National Institute of Health Research in England. And they want me to basically tell you that everything that I say to you is does not necessarily represent their views. So there you go, disclaimer is done. So what are we going to look at tonight in our workshops? So we're basically going to have a look at what is the evidence, what do we know about shift patterns in healthcare in terms of the impact they have on staff well-being and health, the impact on patient care, and impact on costs and care organization. And then also having a look at how then can we use this knowledge to design better work patterns, work schedules. So probably you have received an email or a message that if you could download this app called Vivox for the session, that would be great. If you haven't, don't worry. You can either download the app or just join at vivox.app. And it's basically just a way that I'm going to use to interact with you, to ask your opinions. Yeah, especially just to get to know you a bit. And in terms of the shift patterns that you work. So once you have downloaded the app or once you've accessed vivox.app, the meeting ID is 134-928-199. Okay, let's have a go and let's see. So the first thing I would like to ask you is, what is the length of your typical shift? Either as a student nurse or as an newly qualified nurse. So just please let me know what kind of shift do you usually work. I can see some people are connected. That's great. It means that it's working. Oh, brilliant. I see the numbers are going up. Thanks for that. Okay. So you just need to click on the response. You don't need to press send or anything like that. Just click on it and it's automatically sent. Right. I guess, yeah, more people are joining, which is great. Thank you. Okay. So I'm gonna give you 5 more seconds. Okay, let's have a look and see what are your typical shift patterns. Okay, so all right, so most of you work more than 8 hours, but less than 12 hours. So I would be really interested to know what that means. So is it a 10-hour shift, a 9-hour shift, or what? And then again, a lot of you work between 12 and 13-hour shifts, so probably a 12.5-hour shift. And then a few of you work a mixture, and no one is working 8-hour shifts. So that's really interesting. So let's look at another question I have for you. Which is your favorite shift pattern? So if you've never worked an 8-hour shift, probably there's no way you could know if it's your favorite one, but let's see what you think. Okay, a few more people are still waiting. Brilliant, thanks. Numbers are rising, brilliant. Okay, then 5 more seconds. Okay, so most of you like to be able to to mix long and short shifts, and some of you prefer long shifts. Very few of you prefer either 8 or 10-hour shifts. Okay, brilliant, thanks. And then last question, and then I'm gonna leave you in peace. What do you think about 12-hour shifts? Are they safe for patients and great for healthcare staff? Are they unsafe for patients and great for healthcare staff? Unsafe for patients and not ideal for healthcare staff? Or are they really awful altogether? Okay, 10 more seconds. Okay, thank you so much. I'm gonna close now. And right, so most of you think that 12-hour shifts are not great, but yet a lot of you say that they're your favorite shift patterns. So that's really interesting. Thank you so much. So let's now move on. So let's just start with a very short kind of historical perspective. So why were 12-hour shifts introduced in nursing? So this is, as you can see, a very old paper, so late 70s, from the US, of course. You know, the US are many times the first and kind of pioneers when it comes to changing things, and they were the first to kind of implement the 12-hour shifts. And they argued that basically with 12-hour shifts, you could have better quality at a lower cost. And this is something that also then we in England, or in the UK, let's say, because we're also in Scotland now, so apologies. We have kind of taken on and kind of copied from the US. And basically, again, with this idea that we would be increasing continuity of care and reducing costs, based on the fact that with 12-hour shifts, there's there's fewer overlaps during the day, and that means, of course, saving staffing costs very, very easy. And then, of course, increasing continuity because you have fewer handovers, and so fewer occasions of also, information being miscommunicated, and also patients get to see the same nurse throughout the day. And also then, of course, staff like 12-hour shifts, and I think from the Vivox poll, it was very evident that you also prefer them or that you like them a lot. So that's something that basically means that 12-hour shifts are really a thing now. So based on the assumption that they save money and also that many staff like them. So the overarching aim, let's say, of the work that we have been doing and that we are, still doing, is really to understand what happens to people, to nurses, when they work 12-hour shifts, and what is the impact then on the patient care and also on the organization costs, with the ultimate goal of improving healthcare staff's schedules to maximize their well-being, job performance, and the quality of care that patients receive. So Kim was talking earlier about fatigue and shift work, and really this is what happens to your fatigue levels while you're working. Basically, you can see that for the first 6 hours, the fatigue is kind of stable, and then after 9 hours, really it starts to increase, and basically at 12 hours is more than double of the fatigue levels that you had at the beginning. And this is really the underlying assumption that explains a lot of the research that we are doing. So fatigue when we're working 12-hour shifts is really, really, really high, especially towards the end of a long shift. So what happens to nurses when they work 12-hour shifts? So in terms of outcomes like satisfaction, and also intention to leave and burnout, we can see that when nurses are working 12-hour shifts, they are more likely to experience these outcomes compared to nurses working 8-hour shifts. And this is these are results coming from a very large study that we did on more than 30,000 European nurses, so a really big sample, and this is what we found. And it was similar when it comes to patient care. So when nurses are working 12-hour shifts, the quality of care that they can provide is decreased, the patient safety as well. And also, very interesting, they are more likely to report missing care. And you might think, well, actually, if I have a long shift, it means I have more time to do my stuff, all of the things that I need to do. But actually, probably because you're more fatigued, it means that you need to pace yourself much more to get to the end of the shift, and therefore it might mean that some of the things that you wanted to do, you're actually not able to do them. And so what about reducing handovers? That must be a great thing, because of course, patients, there's no information that is lost during handovers. Actually, again, when nurses are working 12-hour shifts, they're much more likely to report that they're missing patient information, they're miscommunicating patient information during handovers, and also that the continuity of care is lower. So again, opposite finding to what we would expect. And not only that, also there's fewer opportunities of engaging in educational activities. That would be really what most of the times was used during the long overlap between an 8-hour shifts. So a late and an early, there would be a quite long overlap, and that would be used many times for educational activities, CPD. But of course, once you take that long overlap away with 12-hour shifts, that is not there anymore, and that is reflected in the research that we found, and as well as opportunity to discuss patient care with colleagues. So outcomes, that are not probably as serious, you might think, as, I don't know, medication errors or burnout, but on the other hand, there's still important activities, important parts of nursing that are eroded when 12-hour shifts are happening. And this is from what was my PhD. So we were looking at the proportion of 12-hour shifts worked in the past 7 days on the likelihood of nurses experiencing sickness absence. So with this study, it was really good because we were able to basically look at the shifts that nurses had worked prior to experiencing sickness absence. So it was really good in terms of establishing a temporal effect of 12-hour shifts. And again, we found that the higher the proportion of 12-hour shifts worked in the past 7 days, the higher the odds of experiencing sickness absence. And again, something else that we looked at was the cost kind of impact of having 12-hour shifts, again, because one of the big assumptions is 12-hour shifts save money. Actually, we found that it's not really the case, especially when you are using mixed shift patterns. So a lot of you said, I really like to mix shift patterns. And it looks like that is not really a cost-effective option, actually. So, but again, then when you look at 12-hour shifts only, so when you look at using 12-hour shifts only, not a mixture, the costs are essentially the same as using 8-hour shifts only. So my argument would be, well, then if you then have a lot of extra adverse events or even just the nurse's sickness absence, then the costs are definitely going to be higher for 12-hour shifts. So that's what we would all conclude, right? So let's scrap 12-hour shifts. Some experts have argued, is it time to pull the plug on 12-hour shifts? Actually, this is what happened in the US, in New York. It was a long time ago now, but basically a hospital, even before we did all of our research, a hospital understood that, you know, there were some dangers associated with 12-hour shifts and decided to revert to 8-hour shifts. And basically what happened was the staff, the nurses, decided to go on strike because they really wanted to work the 12-hour shifts. So, and they said, you know, if you don't give us back the 12-hour shifts, we're gonna all move to another hospital that allows us to work 12-hour shifts. So the answer is definitely not let's scrap them, because, you know, we're already, you know, looking at huge retention and recruitment problems in nursing. So we don't want to lose more nurses because we're not allowing them to work the shift patterns that they like. So I would say really, and this is really similar to what Kim has already said actually, but I think that what we really need to work on is minimizing fatigue, first of all. So no overtime, for example, at the end of long shifts, avoiding quick returns, and bearing in mind that actually when you work 2 12-hour shifts in a row, you are doing a quick return, because even though there's 12 hours between one shift and the other, if you take into account the handover and then getting changed and going home, actually when you get home you've got less than 11 hours. Respecting days off is essential, breaks, and identifying workers at higher risk for increased fatigue. But Kim has already talked about this very extensively. So when you look at the risk and benefits of 12-hour shifts, so if you think about the reasons why they were implemented, there's actually no reason, no evidence that for these benefits. You might adopt them because staff prefer them, they fit well with their work and their lifestyle, and also for retention, work-life balance. So that's really important. But on the other hand, we have seen that, for example, in our large European study, that when nurses work 12-hour shifts, they're more likely to want to leave their job. So again, that's really something that we really still need to unpack a lot, and recognize the risks. So risks, of course, of increased fatigue, sickness absence, risks to patient care. It may actually require more staff than fewer staff. So that's also very important to be aware of. And then, of course, minimizing the harms as much as possible. I would also say something that, you know, we haven't really explored in our research, but I think is also really important is, for example, exploring the opportunities of self-rostering. Of course, I would have to say, if you allow self-rostering, I think there still have to be some rules that you put in the system so that, for example, staff do not work more than, I would say, 3 long shifts in a row, even though I think 2 is probably enough. Or, you know, not working at night and then a day. So there would have to be some rules that you put in a system, but definitely giving staff control over their working patterns seems like a good way forward, definitely. And I think this is it. So I wanted to see if you have perhaps changed your mind after this presentation. Actually, probably you haven't, because you were already thinking at the beginning that 12-hour shifts were not safe for patients and not ideal for healthcare staff. But can I just say that actually these results that I got, so the fact that you prefer them, but you think they're not safe and they're not ideal, I think really, to me at least, speaks of really the next step that we need to do with research. So, and it's great because the next study that we're looking at really is going to unpack this preference. So why so many people prefer them when actually they recognize that there are so many limitations to them. So that's really it's really great, because I think our next step is going to be meaningful for nursing and for patients, of course. So let's see what you think now. I'm gonna close the survey in 5 seconds. Okay, so you all think that 12-hour shifts are unsafe for patients and not ideal for healthcare staff now. So, okay. Yes, that's it. So thank you very much for listening. I'm happy to take any questions.
Thank you, Chiara.
Thank you, Chiara.
I can see that both these presentations have prompted many questions. However, please add anything you would like to ask to the Q&A. So audience, it's over to you. So some of the questions are coming in. The first question, how can students, perhaps with RCN help, challenge clinical placements and universities when they get very poor placement shift notice? Kim, would you like to take that one first?
Thank you, Eileen. Yes, I mean, I talked about the social rhythms and how can you plan your life? How can you plan your studies when you've got assignments due in around, you know, very short notice shifts? So I think it's very hard to stand up on your own to challenge them. So I think, you know, if you get together as a group and make a case for better notice, so writing a letter to your mentor or the organisation, just to explain that, you know, this is causing you difficulties, and sort of try and get them to move that way. Speak to your RCN student ambassador as well to get some support. But I think it's quite hard to do it on your own, and my advice would be to try and get together as a group.
Okay, Chiara, before I put the question over to you, I would just say in Scotland, most of the universities, if not all the universities, have a reason concerns policy that they've agreed jointly with their health board. So that's worth looking at. And most of the boards in Scotland, I believe, have roster policies. So I know that because I wrote the first one that was kind of then copied and spread across Scotland. And the roster policies, you should get your hands on the roster policy as well. And if your rota or your roster's not meeting that roster policy, then use the raising concerns and raise it with your university, who then should act on your behalf. And as Kim says, the student ambassadors or an RCN rep could also help you. So, Chiara, what options do you think people have if they don't want to work 12-hour shifts?
Well, I think there's many other options. I think again, I'm sorry because I'm not familiar with Scotland, so I apologize for that. I apologize if my answer is not relevant to your context, but definitely I know in the NHS in England, the system, you know, we're so desperate for nurses that I'm sure that you would be allowed to work any other shift pattern essentially, as long as you work. And so I would say, so first of all, if you are an NQN or if you're a registered nurse, not if you're a student, of course. So if you are a registered nurse, speak to your ward manager and talk to them and ask if there's any other options. And also, I think if you're a student, again, I'm talking about our experience here in England and with our students. Definitely, students are not forced to work 12-hour shifts. They cannot be. The thing is, of course, if you don't want to work 12-hour shifts as a student, but the ward or the unit where you're working does 12-hour shifts, then probably it means that you will have to do extra shifts than the one that you are assigned to make up the extra hours that you're not doing when you're working 12-hour shifts. But I would say, definitely based on the experience I have here in England, the option not to work 12-hour shifts is there. I don't think there's anywhere that I'm aware of where 12-hour shifts are mandatory, and it shouldn't be really. And if you go and speak with your manager or with your, I don't know, practice assessor or people in the university, bring all the evidence and say, actually, you know, this is why I don't feel comfortable working 12-hour shifts, and I don't think it's fair that you kind of forbid this you kind of impose this on me, I would say. But definitely, again, I think going back to the point that Kim was making, being part of a union, being part of a, you know, of a group of people that can, you know, lobby with you and hence support you when you are asking these kind of questions, I think is really important from my perspective.
Okay, Kim, is there anything that you would like to add to that?
I absolutely support what Chiara said. I suppose anything to add is that, you know, if you do have a long-term condition that is affected by a long shift, then it's definitely worth, you know, having a discussion about that and seeing if any adjustments can be made, and a reasonable adjustment may be to do a shorter shift. But that's definitely worth opening up discussion if you do have a long-term condition. I think that's another avenue that can be used.
So the next question is really interesting. Why are nurses not given dedicated space for breaks in the way medics are? Kim, can I give that one to you?
Okay, so the short answer is it's in the medic's contract. So it's in their collective contract that they have rest breaks and rest areas. I don't think it's perfect in all areas for doctors. I think some areas are better than others. So it's a contractual requirement. So unfortunately, we don't have that for nurses. But I think, and I hope that the tide is turning a little bit. I think if there is a positive to come out of COVID, I think a lot of organisations have upped their game in terms of providing facilities for staff to rest and take breaks. So lots of areas were repurposed towards being made staff restrooms. So I think, you know, there's certainly a recognition. I think there may be maybe cultural issues. Maybe as nurses we don't fight for our rights as much as doctors do. Yeah, it's a difficult one. I think, as I say, I think things are beginning to improve in some places. We did a whole load of work about 2 years ago now called Rest, Refuel, Rehydrate, where we built the case for having rest areas, having access to drinking water. And I know some organisations have taken that on board. They've used charitable funds. Sorry, I know it's got a different name in Scotland, apologies, but they've used the charitable funds arm of an organisation to fund improving facilities for staff, because they know about the impact that it has on patient care. So it's a justified use of charitable funds. So it is improving, but I think, you know, there's more that needs to be done. And I think locally, again, it's about getting together, speaking to your RCN steward and safety rep in that organisation, and trying to get together and try and get your organisation to look at where they can provide improved space. And again, I know in some areas, COVID has made it, with the social distancing, COVID has also made it more of a challenge. So yes, so sorry, I've kind of gone a long way around answering that, but the short answer is it's in their contract, but the longer answer is that things are improving, but it's a bit slow. And I think, you know, there is more that we can do nationally and UK wide as the RCN, but also some stuff that you can do locally. So have a look at the RCN Rest, Rehydrate, Refuel resources.
Okay, and I think I would add to that, if you do have facilities in your hospital, use them, because if you don't use them, you lose them. And I you know, I've had to argue to keep facilities, especially on night shift. I think a lot of facilities have gone. Even the opportunity for a hot meal in a lot of places has gone. Chiara, do you want to add anything to that, particularly?
Yeah, I agree with everything that you said. I was just thinking that, yeah, for us also, I think as nurses, sometimes there's that cultural element. So there's a lot of research recently that I find really fascinating on the kind of super nurse culture. So the idea that we do not need breaks, we don't need to rest, we don't need to have a nap or to refresh, refuel, because we're these kind of superheroes who can, you know, withstand anything. Actually, the truth is we're also human beings, so we really need to take breaks and to rest. And so I would say sometimes the reason is also that we have this culture that also kind of interferes with fatigue risk management, and yeah, that was my only other comment.
Okay. So I think this one has been in the media, or it's definitely been in the nursing press, but what should I do if I'm told I'm not allowed a water bottle on my ward? Again, Kim, I think this is probably one close to your heart.
Yes, so again, we've challenged this practice in terms of our Rest, Rehydrate, Refuel resources. So, you know, people are being told, oh, it's against health and safety, it's against infection control, but sometimes it's just it's a matter of being controlled. And, you know, when you actually chip away at those reasons, they're just, what's the word I want? They're just sort of, they're not valid. I mean, there may be valid reasons in terms of if there's an outbreak of C. diff or something like that, that, you know, there may be some restrictions, but be very clear that the law requires employers and organisations to provide easy access to, the word is wholesome drinking water. So there is a legal requirement that you should have easy access to drinking water. Now, if that easy access means you have to walk miles down the corridor to the canteen, then that's not easy access. So, you know, there should be you should be able to have easy access to drinking water in a ward environment. Now, that might not be a bottle at the patient's bedside, but there may be an area that can be put aside to actually store drinking water, like a hydration station. Now, I would point you to Hilary Nelson, who's an RCN steward at Forth Valley, and we've got a case study about what Hilary did as an RCN steward in Forth Valley to challenge this issue and to get the organisation to provide a hydration station for nursing staff, firstly in the ICU unit, but then that's rolling out across the organisation. And let's be very clear, if you're dehydrated, that impacts on your cognitive function. There's a lot of research around that. So again, this is a safety issue. It's a patient safety issue as well. So our Rest, Rehydrate, Refuel resource sort of challenges some of those myths and gives information and advice on how to tackle those issues. But I think have a look at the resources, speak to your RCN rep, and see if you can challenge those areas. And also work with infection prevention and control as well. So I think that, again, that's very much what Hilary did at Forth Valley. So yeah, I think definitely don't take it as a given, challenge it.
Chiara, is there anything that you could add, say, from a research point of view around the link to hydration to fatigue?
No, I think Kim put it very well. So no,
okay.
I have nothing to add.
Okay, I'm going to let Kim have a wee break for a second, and this one's for you, Chiara. Interesting to hear about all the research. Could Chiara say more about the next research she is about to begin?
Yeah, sure, happy to. So there's a project that I'm leading and just started at the beginning of October, and basically what we noticed is really this incongruence, this huge incongruence, this huge gap, I would say, between the fact that we see so many negative outcomes when it comes to 12-hour shifts, but on the other hand we see a preference for 12-hour shifts many times. And so really what we want to do with this study is to go in and understand and unpack the reasons why people prefer them, and what is it that people make people prefer 12-hour shifts. Not all, of course, not everyone does, but some, and I would say a lot of people do. And so understanding also the constraints, because sometimes it's not so much a matter of preference in terms of, oh, I really like them, I really enjoy them, but sometimes it's a matter of also, I don't know, I have childcare, and so I cannot afford to pay for 5 days of childcare, and I can only pay for 3, so 12-hour shifts allow me to pay only for 3 days of childcare. So all of these things that are pretty much anecdotal, we're trying to really unpack them with a formal research study. So we're going to be doing a survey, and so yeah, start from there. So with this survey, and then something else that is currently missing from the research perspective is that the research that we have done was mostly in acute care hospitals. So we don't really know if the evidence also translates into mental health and community hospitals. So we're gonna go into these kind of hospitals to see, well, first of all, if we can collect the same data that we collected in acute care trusts, and basically replicate our analysis there and see if our findings also, if we find the same findings. But yeah, a lot really has to do with unpacking preference when it comes to shift patterns, I would say. Yeah.
Okay, the questions are slowing down a bit, so I'm going to be a bit controversial and throw in a couple of things. So I found an article a few years ago, and it was written by a journalist, and it was off the back of one of the RCN's reports on how pressurised nurses were, and they were working long hours and etc, etc. And the title of the report is, "If nurses are really at breaking point, they should stop working 12-hour shifts." And the journalist, who was not a nurse but had volunteered at the London Olympics, basically said, you know, she found it difficult after 6 hours to keep a smile on her face and be compassionate and caring. So how can nurses do this over 12-hour shifts? Her words, not mine. No wonder nurses retreat to their computers and coffee rooms at every opportunity. No wonder they ignore patients' bells. No wonder they may not be as compassionate as we would wish. They are 10 hours into their 12-hour shift with a 2-hour drive to get home. Apparently no one thinks anything is wrong. And our plea is to ask the patients, you know, if nurses say that they prefer them, but there may be an impact on patient care, etc. Why don't we ask the patients? And another piece of journalism that I found was, if a piece of medical equipment or a nursing procedure was known to endanger patient safety, we would quickly work to fix the problem. So I'm putting that out there to be a bit controversial, hoping that it inspires more feedback. Chiara, do you want to comment on that, or?
Yeah, absolutely. No, I absolutely agree. And also, I have to say, when I'm not currently in clinical practice, I'm an academic, but when I was in clinical practice, I remember that after 6 hours, really, I was starting to see that I couldn't function really well. And at the end, even of an 8-hour shift, often I didn't remember, like after especially a couple of shifts, I couldn't remember my name. So it was really I mean, the fatigue was real. And so if you ask me, for example, I would never want to work 12-hour shifts. The thing is, because now they are in the system, and I agree. I mean, I think they're really dangerous for many reasons, and I think they're very dangerous because we don't have enough staff. Staff many times cannot take the breaks. On the days off that staff have, most of the times they will choose to work additional long shifts, like as bank shifts. So we've got an enormous, you know, amount of problems that are associated with 12-hour shifts. But again, on the other hand, my real concern is, again, thinking about the workforce in general, the nursing workforce in general, is that if what we end up with is with people leaving the NHS or, you know, nursing, which is even worse, because they cannot work 12-hour shifts, we really have a problem. We really do. And that's why I think we cannot just say, okay, let's scrap them, even though I think, you know, it would be really the best thing for patients and for nurses as well. So we really need to work with nurses to find solutions and to find ways to make 12-hour shifts more manageable, because I'm really afraid they're here to stay. I mean, we can keep doing the research, and to be honest, it's one of my personal biggest joys when I find nurses who tell me, you know, I have read your research and now I'm not working 12-hour shifts anymore. It's great, but on the other hand, you know, I cannot, you know, force people to do that, and I think no one can actually force nurses to do that.
Okay, Kim, do you want to come in there?
Yeah, if I may, I'm really interested to see the next stage of research, because one of the other issues that we're aware of is that nursing staff like the 12-hour shifts because they get the days off, and then on those days off they can go and do extra work, bank work, agency work. And so I think this is all intrinsically linked with pay and the value of nursing as well. And as a plug for our Fair Pay for Nursing campaign, so 12.5% pay rise so that nurses don't have to work in those days off to make ends meet, particularly in the current context where partners may be losing their job as a result of COVID. So it's intrinsically linked with affordable childcare and with fair pay for nurses as well. So it's a bigger societal issue, isn't it?
Okay, so someone's asked, the previous alternative to 12+ hours were early shifts and lates for up to 10-day stretches. Would they have been, or are they, any safer? Chiara?
Yeah, so I would say probably not. So I wouldn't say they are more dangerous, but probably they're not safer than working 1 12-hour shift. But again, think about the evidence that we have. So the evidence that we have from real world data shows that when nurses worked 8-hour shifts, so possibly even 5, say, or 6 8-hour shifts in a row, they are still less likely to experience a lot of negative outcomes themselves and also patients. So I get the point that is being raised. So working 10 shifts in a row is probably not great. Is not safe, and is not even safe for a nurse to work. I mean, it's not safe like in terms of your health to work those many shifts in a row. So I wouldn't say yes, it's best to work 10 8-hour shifts than 1 12-hour shift. But again, when we think about the complexity of it, many times then also have seen with my own eyes real data showing that nurses working 12-hour shifts were working 7 12-hour shifts in a row. And so that's incredibly dangerous. As I said before, from the evidence that we have, I think 2 long shifts in a row is probably, you don't want to be doing any more than that, to be honest, if you want to be safe. So I would say, yeah, it's a complex thing, but definitely if you look at the data, 8-hour shifts are safer.
Okay, Kim, do you want to add anything to that?
No, nothing to add to that.
So I think I would just add something. As somebody, as you could probably tell, old enough to have worked a variety of shift patterns, so worked 8-hour shifts. Core night shift was my first post, working permanent night shift, then permanent day shift on 8-hour shifts, and then day-night rotation on 3-shift pattern, and then on 12-hour nights. I think every shift pattern has pros and cons, and it's about minimising the risks by effective rostering. And I would agree 10-day stretches should not happen. And again, I think in Scotland, if you look at each organisation's roster policy, for those that are still on 8-hour shifts, I would hope that all those policies still have in them that you should work no more than 7 days in a row, and even 7 days I think is pushing it. But I think that's what the policies say. I was struck by a slide from Kim about shift work is risk work. Are employers also looking to reduce the use of 12-hour shifts? Kim, do you have any insight on are employers looking to reduce the use of 12-hour shifts?
I don't have any sort of empirical evidence to say one way or another, but I think, as Chiara articulated, you know, the cost implications, the short term, the workforce planning and the short termism at the moment, I don't think they are. That's my feel of things. So the answer is that no. So there's potentially a job of work to do around educating employers as well. And sorry, I did have something to add to the previous discussion. Sorry, just come to me now. In around, I mentioned the working time regulations. So there's also an issue around making sure employers are compliant with the working time regulations. So no more than a 48-hour week over a 17-week reference period. So, you know, some of these could be tipping over into that. And of course, you are allowed to work more than 48 hours a week, but you have to do it voluntarily and sign an opt-out. So, you know, again, some of these patterns, they may be really pushing on breaching of the working time regulations. So I think that's something to be aware of. Sorry.
Chiara, are you aware of any employers looking to reduce the use of 12-hour shifts?
No, not at all. Actually, quite the contrary. I think no, I think we are seeing, at least in the data that we get from trusts, we see that 12-hour shifts become the norm more and more. I think especially, and also worldwide, it is something that I have seen and I found really disappointing. Although I can understand the logic behind it, that during the pandemic, 12-hour shifts have become the norm. Also in countries like Sweden, for example, where they would never work 12-hour shifts, or other countries like Switzerland as well. So with the pandemic, they have started to introduce 12-hour shifts, which in my opinion, again, is not really safe when you think about, having, longer time when you are at risk of catching the virus and then spreading the virus. And also, if you're all donned in your PPE for 12 hours, that's really, really awful, I think. But yet, that's something that people are doing because I think most of the times there's a bit of short-term planning rather than long-term planning. So we think, oh yeah, with 12-hour shifts, we're gonna fill our gaps, that we're fine, without thinking really at the long-term consequences.
Yeah, I would agree with that. I think we've picked up that there are some employers due to COVID have introduced 12-hour shifts where previously they weren't worked, which is counterintuitive in many ways, because your evidence shows that you're more likely to make a mistake, or their injuries to nursing staff increase after 8 hours. It goes up. So the importance of donning and doffing properly, etc., etc. The risk would increase, and I think there was some evidence from China that the viral load increased on staff who worked longer shift patterns rather than shorter shifts, but more days. So yeah, more work to do. What do the panel think will influence employers to change away from 12-hour shifts? Chiara, I think this one's for you as well.
Yeah, well, I think it's in this sense, I think you are also have got a huge role to play. You as individuals, you as nurses, as students, as members of the RCN, you have a huge role to play. So what I can do is to keep doing the research. I also can try to engage with policymakers and also, hospital managers and staff. But I think if it also comes from you actively, well, first of all, knowing the evidence and also being able to collect the data. So for example, saying, after we started using 12-hour shifts on the ward, look at how many absences we've got now, or look at what happened to patient falls. So if you also start to do that job that we do, of course, in a kind of systematic way and collecting loads and loads of data, but you as well can play your part. So I don't say to put the weight on you, but on the other hand, if we tackle it from different angles, I think there's a really much higher chance that we can convince employers to get rid of 12-hour shifts. That would be my.
Kim, from your perspective.
I think again, this is intrinsically linked with the workforce supply, isn't it, as well? So there's an issue for governments to look at this. So the work we're doing around safe staff and safe and effective care, or the pay work, the fair pay for nursing. So it's those issues that hopefully will potentially make a difference to the supply. But I think the patient safety arguments, sadly, the patient safety arguments sometimes resonate more with employers than the staff safety and well-being. So, it's using the patient safety arguments. But, I tip that on its head. If you actually have tired staff who are unwell, who are going off sick, then that has a massive impact on patient care and patient outcomes. So, as Chiara has shown. So, I think often they look at the pounds and the pence, but actually it should be looking at your patient safety. And I always say you wouldn't allow a pilot or the cabin crew to fly a plane tired and exhausted. We know the massive consequences that can have. So why would you, allow nurses to work tired and exhausted. You know, you might not have a whole plane falling out the sky, but you know, you will have errors, incidents, issues. So I think it's the patient safety elements that are really important.
Okay, I'm going to stay with you, Kim. What would be your top tip for us as students to adapt to a new shift pattern?
Oh gosh, well, I feel a real fraud because I haven't done shifts for a number of years. So, I mean, I would throw that back to the audience to get tips from each other. What's worked well for you? You know, I think there's a real, that's a real need to kind of have opportunities to share what's worked well for you and share your tips. You're the people doing doing the work. I mean, I think probably the most important thing is try to get your sleep hygiene sorted and try and get some quality, not so much quantity, but try and get some quality sleep really. And I think, you know, with sleep, everything is easier. So yeah, but I would throw that back to somebody who's actually doing shifts and, you know, to give that advice.
Chiara, do you have any advice?
Yeah, very similar. So like Kim, I haven't been working shifts for 9 years now, so no, 8 years now, so probably not the best person. I would also say be kind with yourself. So it's gonna take time to adapt to shift patterns. When you start working night shifts in particular, it can really kind of mess up all of your, you know, circadian rhythms and stuff. So so yeah, be patient. It's gonna take some time to adjust and really then find the routines, the things that basically help you, and yeah, because it's gonna be different for everyone.
Okay, we've got a comment here. So the focus at these RCN events on our well-being is great to see. When we move from being a student to a newly qualified nurse, this is so important. So thank you for that comment. That's really good feedback. I'm looking down the questions. Just bear with me a second. So we know what. So I think we've heard tonight that we know what we should be doing to help ourselves, but it's not easy. So what one thing do you think makes the biggest difference in coping with staying well while working shifts? Kim?
Oh gosh, it comes back to the question before, really, doesn't it? About, you know, somebody hasn't done shifts for a long time. I mean, I sort of work on the evidence and what the reports, you know, say, and books like How to Sleep Well. I mean, again, I think it comes back to quality sleep. If you can get that, if you can get some quality sleep, that's really important. So that's what I'd say. And you know, there is you know, there's the apps out there that can help you. And I think, sorry, it's not one thing, but it is related to sleep. It's about the anxiety, because if you've come off a really horrible shift, you've got all that worry, you're physically exhausted, but you can't get to sleep because you've got all these things worrying about what you're going to go back to the next day. You know, if you can get that sort of mindfulness, look at those apps to kind of help try and unwind you, and then get, you know, a book by the side of the bed to dump all those concerns on, you know, so that you're not holding them and waking up at 3 in the morning or 3 in the afternoon worried about them. Then I think that really helps. It's getting, you know, sort of quality of sleep and trying to sort of manage that anxiety related with coming off a shift.
Okay. Chiara, can you think of one thing?
I would say definitely prioritize rest, prioritize resting, sleeping. So like Kim suggested, sleep hygiene is really important. That would be my probably the first and most important aspect. But I would also say something So again, be kind to yourself. So accept that you are not a superhero, that you're not a super nurse, that you are a human being who needs rest. And also perhaps, and this is something that we as nurses are great at doing, is also noticing when your colleagues need rest. I think that's, yeah, because we are, you know, that's the way we are compassionate. We pay attention to other people who are in need. So if we notice a colleague or a fellow student who's really tired and really needs a break, let's encourage them to do that, because we would want them to do the same for us, wouldn't we? So to tell us, I think you really need a break now. And I can tell it also, you know, not working shifts, but every time that a colleague comes to me and say, you know, Chiara, I think you need a break now, it actually feels like a relief that someone is acknowledging that I'm tired. And again, to re-embrace the fact that I'm human.
Yeah. I mean, I would agree. I think what I've taken away from tonight's event and our previous event with Richard, Kyle and Ben from Wales around nurses well-being is the key message is to look after yourself and look after each other. So take your breaks. If you can't take your break, escalate that. You know, don't be the superheroes that say, you know, we'll just need to dig deep and carry on. Yeah, look after yourselves and look after each other, I think is the key message that I would take away from this. I mean, the other thing is somebody said it's great to hear about the RCN rep who set up hydration stations. Are there any other examples to hear? And I think there are many examples, and there's lots of resources on the RCN website, Kim, that I'm sure that your presentation pointed to some of them, but there are lots of resources there on the website. And one that's coming soon is we're refreshing our raising concerns and escalation resources, and we're linking that to psychological safety, because one of the key things around staying well and looking after each other is being psychologically safe to do that within teams, and that is about good relationships, good team working and feeling safe to say, actually I need a bit of help here or whatever, and not trying to be the superhero. So watch out for those resources. There's another comment, not a question, but I know we're coming to the end of the evening, but I'll just try and read this. The app Headspace is the single most helpful invention I have found for my own well-being, especially with winding down from a shift. Every time I need to fall asleep, I put it on, even after a night shift, and it really helps me. So thank you for whoever shared that. That's a good tip. So just in summing up from tonight and the other events, I think last year's Students and Newly Qualified Nurse Conference in Scotland was actually in Dundee, my hometown. There was a plea to focus on wellbeing, and I really hope that the sessions that we've had over the last three events have helped you with that. What I would say again is please share your stories and your experience on SenseMaker. Especially linked to what the issue of your well-being. If you don't have access to breaks, etc., put your stories there, because information is key to our ability to lobby and put forward the concerns of nursing staff, students, healthcare support workers. We absolutely need your information to help us do our job, to fight for